So fungal acne. I know you're probably curious, how do we get fungal acne? Well, first of all, let's talk about fungus. Acne is just the physical appearance of pimples or redness or things that you just don't want to see on your face. But fungus, there's multiple organisms. We have viruses, fungus, bacteria, and parasites. But let's talk about fungus. Why would we even get fungus? Well, you're not going to believe it. There are so many antibiotics in the food supply and everything that you eat. Then what do? They give antibiotics for acne. What do antibiotics do? They create a disturbance in the microbiome of the balance of bacteria and fungus, and you get an overgrowth of fungus. Then if you take oral contraceptives, childbirth, cortisone, eating mushrooms, eating yeast product, eating peanuts, all of these things have fungus. So unfortunately, we are overloaded with fungi. And so what do you do about fungi? Well, the first thing dermatologists do is they prescribe antibiotics. Well, antibiotics destroy the entire microbiome and the balance of those bacteria and yeast. And so now you've got a continuation of the fungi growing not only on your face, maybe internally. So what do? Well, first thing you want to do is, I know for women out there, you can't get rid of the oral contraceptives, but what you can do is you can take probiotics. You can use antifungal things on your face. One of the things that we do is endolaser to get rid of acne. And what it does, endolaser has special light frequencies that eliminate the fungus in the face. The other thing you can do is simple little antifungal remedies like coconut oil, like a grapeseed extract, like oregano oil. You can do oregano orally and topically. So, but you must change your diet. If you're eating lots of sugar, lots of carbohydrates, lots of yeasty type things, they're going to encourage the growth of these fungi.